Obesity really does need to be seen as a chronic disease that needs to be managed over time. We know that taking a simple approach to obesity, eat less, move more, get your weight down and you'll be fine, just is an abysmal failure.
The barriers in treating obesity in primary practice today is I think it's the lack of knowledge, the lack of tools.
The 5 A's of obesity management developed by the Canadian Obesity Network provide healthcare practitioners with a clear pathway to addressing obesity as a chronic condition in their practice. The first step in the 5 A's of obesity management is really asking the patient for permission to speak about obesity.
It's essential that in order to reduce stigma, to reduce bias, and to decrease frustration, that the patient has reached a place where they want to start to make some changes to their weight. We shouldn't assume that because we think their weight is an issue, that they think their weight is an issue.
The current clinical definition of obesity is based on body mass index, which tells you how big someone is, but it doesn't necessarily tell you how sick someone is. Staging obesity, where we look at comorbidities, where we look at physical functioning, where we look at mental health issues and quality of life in patients, we get a much better understanding of the actual risk that a patient is at. And of course, it is that risk level that ultimately needs to guide our intervention. It's very important to actually look at some of the driving causes. Is it a socioeconomic issue? Is it a cultural issue? But there could also be drivers of overeating, like being hungry all the time, not feeling full after a meal. And of course, there can be emotional drivers of overeating, depression, issues around body image, social anxiety disorder, medications that patients are taking. And it is very important in any discussion of obesity to try to identify what those key drivers of excess weight gain are, because very often those drivers also end up being challenges that these patients have in weight management. We move to the next stage, which is the advice stage. So based on that information, we can now advise the patient about their individual risks. We can talk to them about how obesity is affecting their health. And this is also now the time to discuss with the patient and to advise the patient on the treatment options that may be best for this patient based on their level of risk. One of the first conversations that you want to have in terms of agreement is really to focus on and agree with the patient on what the outcomes of treatment are. There's quite a bit of evidence showing that it is better in such conversations to focus on real health benefits or quality of life benefits that are important to the patient rather than just trying to define weight goals or weight loss goals.
I think it's time to stop looking at changes on a scale. I think it's time to focus on the well-being and the health condition of that individual.
Because we're not looking at the ideal weight, but the best weight for the person in front of you.
Now, part of that assisting may actually also consist of providing the patient with information that's helpful. We're talking about patient education. We're talking about pointing the patient to resources in the community, on the internet, that could be helpful to the patient.
Some family doctors will say, okay, I'll refer you to the dietitian, or I'll refer you to the social worker, or I'll refer you to the exercise physiologist. Another family doctor might say, for this particular patient, I'm going to refer him to a bariatric center or an internist.
And what's really crucial in the assist phase is that because obesity is a condition that requires chronic management, we need to also arrange for a follow-up.
I think it's an excellent tool because I think as nurses, it's a challenge for us. And I think anytime there's a tool that's simple, easy to remember, and easy to use, such as the 5 A's, it's helpful.
The 5A program will consist of tabletop tools, information booklets for the provider, information sheets and resources for the patient, and we believe that the 5 A's developed by the Canadian Obesity Network can provide a clear pathway that should enable healthcare practitioners to better address obesity in their patients.